Everyone at Ontario Shores has been rising up to ensure the delivery of quality mental health care throughout the COVID-19 pandemic. Through Rising Up Conversations, we are proud to shine a light on individuals, teams, and disciplines who continue to go above and beyond to care for our patients and each other during these challenging times.
So welcome to Rising Up Conversations. My name is Daryl Mathers and I'm in the Communications Department here at Ontario Shores, and I'm pleased to be joined by members of our therapeutic recreation team. All throughout the pandemic, our staff have been rising up for our patients, for each other, to make sure we're continuing to provide quality mental health care while also dealing with the unique challenges associated with the COVID-19 pandemic. And throughout this, we're approaching a year now. It'll be a year, March 11th. And there have been a great number of stories of our staff going above and beyond, and we're trying to capture them in these Rising Up conversations. So we're going to do that today by talking about therapeutic recreation, which I know is TR or TRs is what we're referring to the individuals who are joining us today. So I'm pleased to be joined by Amanda O'Keefe, Lindsay Winchester, Sarah Reed, and Tiffany Fowler. So thank you for joining us. We are physically distant. We're safe. We're using masks when we're not talking, and we are 6 feet apart, just so everybody watching this knows that we are doing everything we can to tell this story but be safe at the same time. So we'll start just by, I don't know who wants to take this. Maybe we'll start with you, Lindsay, because I'm looking right at you. But tell us, for people that may not know, a little bit about the role of a TR, maybe like before the pandemic, and maybe some things that have evolved like since that time.
So we have a great opportunity as rec therapists to really find out what people's passions are, what they're excited about, and things that they enjoy doing, and making it meaningful for them and helping them find empowerment in what they want to do. And have that autonomy of choice. And I find that with the pandemic, we've had to really rethink just how we communicate. We have to really be compassionate. We always have been, but I think just even more so, and just really that listening piece, being active listeners, really supportive, and be a lot more creative maybe with our programming, because we are limited to being sort of on the unit and on the grounds, as opposed to what we were able to do before, which was, in the community and a lot sort of more expansive.
When the pandemic hit and we were kind of discovering what we needed to do and what we couldn't do as an organization, Tiffany, what was it like when you found out the gym was closed right off the bat, and some of the other programs that our patients rely on, that you rely on with them, were going to either be not available or changed? Like, what was that like early on?
Well, I think it was a little scary at first, because I know me specifically, I work on the geriatric unit. So knowing that this virus, the geriatric population is especially vulnerable, worried about where we can take them and what kinds of things that we can do with them. And then having the gym closed, having the community closed, knowing that we're limited to the programs and our resources that we normally would use to provide programs was, a little maybe confusing and scary at first. But I think we've all kind of developed some new skills over the last year. I know me specifically, I am not really great with technology, which maybe some of the younger girls are. But so I had to learn how to provide programs through OTN and FaceTime in order to keep our patients connected with their families, and to keep some of those programs still happening, because people couldn't come into the hospital to provide things like horticulture therapy, for instance, or music therapy. Those things all have to be done virtually, or like our chaplain, it all had to be done virtually. So definitely challenging.
Amanda, when it comes to our patients and therapeutic rec, how much do they rely on TRs in terms of not to add, I guess, to their recovery journey, like those activities, like how important is it, to have the TRs on a unit working with the patients generally, and especially when things changed like they did in March?
I think extremely important. I think that was probably one of the, I can speak for myself and probably a lot of the RTs, I think especially in the beginning, when we first discovered like the world was shutting down, the gym is closing, the community is shutting down, we had our own fears, we had our own reservations, our own situations with our own families. And I think that was one of the biggest things that was motivating us to push through, to step it up, because we know how important rec therapy is, especially in times of isolation and especially when the world was shut down, that we knew we were family for them, that it would be more important now to provide things such as joy, activities, keeping them engaged with their families, keeping them connected, and just kind of, I guess, powering through the pandemic and changes. So I think it was definitely more important than ever now to help with the isolation and all the things that they were losing.
Sarah, what was it like being part of the team at that point? Like, did you guys all rally around each other and like brainstorm creative ways to work with patients? And what was that experience like?
So we are lucky as like a therapeutic recreation council that we're actually extremely close and we all get along quite well together. So I feel like we definitely came together as a group. Like throughout the whole pandemic, we still met monthly on a basis to like talk about challenges we were foreseeing and new things that we were creating and kind of what ideas we had moving forward as the pandemic continued to happen and our jobs and roles were still impacted. So I would say as a council, we definitely try to continue to encourage each other. Like we tried to, we did more resource sharing than we probably ever have with creating new programs and stuff like that. And we kind of further discussed things in like terms of booking space, and we talked about different special events that we could run. Like certain units did, like Tiffany did like a fiesta around, I think, spring, summertime. Lindsay also did like a caravana event, which typically happens on a bigger full scale. So we kind of used those hospital-wide initiatives and events that we typically do and then ran it on a smaller scale in our unit. So it's nice to have 20 other minds to kind of work together and collaborate during times like these.
I'll ask anybody who wants to answer. Is there something that you learned about yourself or our patients or your colleagues during the last year and soon to be year plus?
I'll say one thing for sure is that I think we've really learned that face-to-face human connection is so important. And I think we kind of like, we know that as rec therapists because that's what we do every day is like connecting with patients. But you really saw that highlighted, I think, during the pandemic because people were so isolated from family, because they were restricted even more than normal being in hospital and not being able to get out into the communities. That face-to-face, having someone to just sit with them and and talk to them, kind of talk them down, give them some information even on the virus and what's going on in the community, and reassuring them, I think, has really come to light, I would say. Technology is great, and it's amazing that we've learned all these skills and we've been able to continue to do some of these things by bringing things in virtually, but nothing can replace that human connection.
I was just going to say, just the need for like their roles. Like we all have roles and jobs, and it makes us feel like we're doing something meaningful. And I feel like that's been really hard, even if it's just been like where they volunteered in the hospital or where they had jobs actually in the community and now they can't go out to their jobs. And that's been a really challenging thing for them. And I feel like they've handled it so well. And that's been really a source of pride, I think, for all of us to see how well and resilient the patients have been throughout all of this.
Yeah, I would definitely say the patients. It's amazing to see how resilient they are, especially when we were in the initial phases of this, that's like, hey, we're gonna lose this, we're gonna lose that, this is being taken back. And you automatically think like, well, how's this gonna go over? How are patients gonna receive this? And we're already a year into this, and it's just amazing to see how much they're coping And sometimes, honestly, I can say that I think that they're handling it even better than I would, and I'm in a situation that I can leave and I can still have access to something. So I definitely kudos to our patients because they're extremely resilient and they've been handling this, I think, the best. So that's really admirable to see.
I was even gonna say, like, it's wild to me how like adaptable you can become to things that aren't like kind of like a curveball thrown your way, like the patients in their lives and even in our lives. Like Amanda got redeployed to like another side of the hospital that she's never worked on, and like a lot of our rec staff have gotten deployed to places that they normally wouldn't work. So I think even when you're not expecting change, like you really can persevere and come through on the other side and develop your skills in ways that you didn't think you would have, just because you're kind of thrown into it. So that's been kind of a positive from the pandemic, that we've been able to change our practice up a little bit and do things that we probably normally wouldn't, but it's for the benefit of the patient. So that's been kind of a nice change in some ways.
You guys mentioned pride, a couple times, and this is probably the most challenging time of your careers, for not just in your discipline, but probably throughout the hospital. And as challenging as it's been, do you think you'll look back with great pride that you were able to contribute the way you have during this pandemic? Is there something that stands out, or anything that comes to mind when I mention that?
For me personally, I think just how flexible, I think Sarah was speaking to that, we've had to be, but it hasn't really been, it's been challenging. We've all felt some sort of burnout, I would say, but I think it just really has shed a light on the importance of therapeutic recreation and just how valuable it is for the patients. Because I think that even just the decrease in code whites and those kinds of things, that gives us a source of pride when we know that because they're having engagement that is meaningful to them, that they're coping well and they're getting through it. And I think that makes us all feel really, really good inside. Mm-hmm.
I think too, like back to how Sarah was talking about the different special events and stuff that have happened. So I know like on the dual diagnosis unit, they had like a 50s kind of themed party, and like she said, like the fiestas, and like bringing those things wasn't just even for the patients, but also for the staff, because many of the staff are kind of feeling that like COVID fatigue. So just having something kind of special to happen, something to look forward to that both staff and patients could get involved in, I think that brings me pride to know that everybody's kind of enjoying it and has something to look forward to when there's been some days where people are kind of down and out, when they, not just the patients, but everybody in general has been restricted to something or other in their lifetime during the pandemic. So,
Well, thank you for sharing a little bit about what you guys have done over the last year, and thank you for all that you've done and continue to do for our patients.
thank you.
Yeah.